to all viewers. Getting a baby is a deja vu feeling. A baby is born to you, you feel great, and that deja vu multiplies if you can actually feed the baby by breastfeeding adequately. But quite often, breastfeeding is strainful, stressful, and a lot of questions are asked about the correct ways. This video clearly describes some techniques for dispelling the myths about breastfeeding. I am Dr. Shobhana Mohandas. I am a gynecologist and laparoscopic surgeon. I work at Sun Medical Center, Thrissur, Kerala. Normally, babies are born, and when the gynecologist goes for the first day rounds, almost 90% of patients to 100% of gynecologists will say, "Doctor, everything is going fine, but my baby doesn't have milk." This is a very common sentence. Number one, the first day the baby needs only 7 ml, the least amount, or 220 ml, the largest amount. So that up to 7 ml to 220 ml is the amount of milk produced in 24 hours by an average woman, which is just 1 teaspoon or half a cup. So you can imagine this is the only amount of milk that is going to be produced, whatever you do in the first day. And the second day, it comes to 40 ml to 330 ml, which is again 1 large tablespoon and 1 large cup. So you should not have expectations that the milk will just start flowing like that. You know what happens with these expectations? You think there is not enough milk, you just press the nipple and see if there is not enough milk, you start giving artificial feeds. And if that is done, the suckling reflex is gone. And unless and until there is a suckling reflex, there is no signaling to the brain. It's the suckling reflex which makes the brain send hormones to the breast, and then there is oxytocin release and there is more milk flowing. So without suckling, there won't be any oxytocin flowing and there won't be any milk production. So it is necessary that this myth is burst, and you have to try and make the baby suckle even if you feel there is no milk in the breast. How else can you increase the milk flow? Drink lots of fluids, whether it is water, juice, whatever you like, but drink 3 liters of it. Because milk, as you know, most of it is fluid, water, and only little bit of it is solid. So you have to drink a lot of fluids. And take high protein diet, because the milk should be rich in protein, then only the baby can grow faster. So it will require less milk if you give good protein in that milk. So that is another tip that you can follow. Third thing, start feeding fast and start feeding frequently. So you have to start feeding within 1 hour of delivery. In my patients, I even give them breastfeeding while the stitch is being put on. So the feeding is started within half an hour. Cesarean patients, within 3 hours, they have to start feeding. And the feeding has to be done every 2 to 3 hours in the first 2 to 3 days. You have to get away from visitors, or you have to have space for yourself and your baby, and do this whenever the baby demands. Another reason why people say that milk is not there is baby suckling all the time. It's not leaving the nipple at all. These are the ones who are having cluster feeding. That means when the baby wants to grow, or when it wants more milk, it will suckle all the time. That's because of the need of the baby. You do not have to worry that there is no milk. It's just that that particular baby needs more milk than a baby who suckles only every 2 or 3 hours for 10-15 minutes at each breast. That's also there. You have to take time. How to feed a baby in any comfortable position, even in the prone position, you can feed the baby. You have to put your areola below the fingers and press all of it into the baby's mouth. And the baby will suck at the junction of the skin and the areola. And then it's easy to suck on that flat area rather than on the nipple round small area. And this is absolutely necessary even for women with very small breasts. So even if the baby needs to suck a lot of times, it normally happens at night. Please let it suckle. If necessary, we can use nipple shields. Because once you start giving formula feeds, the suckling reflex is gone, and then the feeding will all be going wrong track. So, as far as possible, try to suckle the baby and take lots of fluids and proteins to have a happy, happy lactation, happy, happy motherhood. Thank you so much for patient listening.